Hello, my name is Cathy Arnold, and I'm the principal investigator for this study called Improving Capacity to Reduce Fall-Related Injury in Older Adults.
My name is Melanie Weimer, and I was the lead for the Staying on Your Feet program and co-investigator of this study.
I first started collaborating with the Staying on Your Feet program within the former health region in Saskatoon about 8 years ago. Staying on Your Feet was just taking its wings as a program to deliver fall prevention education and exercise to try and address the increase in emergency visits and hospitalizations that are related to fall injury for older adults within Saskatoon and surrounding areas. As a clinical researcher, I too was interested in determining what programming provides the best outcomes for reducing fall-related injuries. The most common types of injuries from falls occur in the upper body. Some of these can be very serious, such as head injuries. Most fall prevention programming has focused on ways to prevent losing balance by training lower body strength and agility. I became interested in exploring ways to enhance fall prevention programming by considering how one could improve their capacity to prevent injury if balance couldn't be restored. Working with my Staying on Your Feet colleagues, we developed exercises focusing on upper body strength and learning to react quickly and land softer on the hands to avoid the high impacts on the upper body that can happen, especially when falling forward.
Hence the beginning of a collaboration that has resulted in 3 studies. Researchers at the U of S teamed up with Staying on Your Feet to deliver a program called Staying on Your Feet Fast, or Fall Arrest Strategy Training. All the good pieces of Staying on Your Feet remain intact. Practicing balance, lower leg strength, learning how to get up from the floor, and then we added in simple exercises like wall push-ups, hands and knees activities to improve stability and strength, and practice of quick reactions of both upper and lower body to help reduce injury risk in the event of a fall.
The value added of this collaboration for me as a researcher was the support for recruiting, connecting with a site to run the program, and working together with the people who are going to implement the research. It's such a great win-win situation. Working with Melanie and the other leaders, including Forever in Motion, created such a great context to put the findings of our research into practice. I also was able to help them tweak and modify their own evaluation tools. This is one of the most diligent healthcare programs I know of in the province that measures outcomes for all of their participants every time. What a great collection of data that has been so convincing of the benefit. Bringing in the University of Saskatchewan to add further standardization and external measurement added further evidence to support the benefits.
Working with researchers from the U of S enabled us to provide the most up-to-date evidence-based exercises in our Staying on Your Feet program. It also challenged us to ensure we were providing the best, most appropriate exercises for our participants. Having the opportunity to work with the U of S provided research to back up what we were already seeing practically: decreased fall risk and decreased number of falls in our participants. The positive research results give us the confidence to encourage continued support of fall prevention programs like Staying on Your Feet and improve on the current fall prevention programs we offer. So, what's next?
What are the next steps for fall prevention in Saskatoon and Saskatchewan? I have been researching and working as a health professional to decrease the risk of falls and related injury in the province for about 25 years. Sometimes I get frustrated as it seems that we can't make any progress. Older adults continue to fall, hospitalizations continue to be on the rise. However, there are positive changes, such as more awareness and more options for people to stay active and to learn about preventing injuries. I am encouraged by the number of men and women in their 50s and 60s who come to us and say, I want to learn about fall prevention now. What can I do? I really believe this is what we need to do. Education much earlier, encourage lifelong activity and awareness of risk. And that doesn't mean eliminating risky play or risky activity during life. It's a larger, holistic approach to health that includes accessibility, breaking down fear barriers, and for leaders in the province to see this type of low-cost programming as a means to reduce the high costs of healthcare that continue to rise as the number of older adults in the province is increasing.
I think we need to continue to encourage participation in fall prevention exercises, even after the classes have ended. Participants need to add these activities and exercises into their daily lives if they want to maintain the benefits they have gained. I also think there needs to be more classes provided by trained professionals so participants can continue to improve their balance and decrease their fall risk even after the initial 12-week program is complete.